Let's talk some ultrasound. Today we're going to talk about 3D and 4D imaging. First, I want to show you kind of how the machine works with 3D and 4D. When we're trying to get a 3D and 4D picture, we have to have baby in a good position. So it's not just the click of this button or this button. Whenever we go to do this, and we put this right in front of what you might know as baby's profile, and I'll show you a picture here in a little bit. A 3D is going to be just a still image. 4D is a live image. You might see the machine stall a little bit because baby's moving a lot. That can alter the image. You cannot get a 3D or 4D picture with a probe that looks like this. This is the probe that we use for a 3D, 4D image. When we're getting an image, we do need to use some type of 3D or 4D probe. There were different type of probes that do different types of things. Now that we've discussed how to get the image and how it's processed in the machine, it's important that you know that not all offices are going to do this. Because every office is different and because every sonographer is different, it's important that all of us as patients understand that we might not get to get a 3D or 4D image at our doctor's office. Not because they're trying to be mean, but because of the time they have. Not all offices have a printer. It is a harder image to get. Not all techs are trained to do it. Some of them do not have the opportunity to do it because their machine will not allow them to. Whenever you're coming to an OBGYN office, this is all going underneath what is known as diagnostic imaging. And I will do another video explaining diagnostic imaging and entertainment imaging. If your office has told you that you can get a 3D and 4D picture, then this is what you would do. Show up on time. You come with a full bladder and that you're well hydrated day before and day of. It does help the ultrasound tech obtain better pictures. You would want to make sure you eat before. There's not much we can do to control our babies being in a good or bad position. Like I said before, stay hydrated, come with a full bladder, and maybe eat a little snack before. And you're going to see them try to get what is known as a profile. It's going to look like this. Once they have that in the frame, they should be able to see the front of baby's face. Now, to not feel defeated if they cannot get a 3D and 4D image, could be several reasons why they're not getting it. If baby's face is up against the placenta like this, or they have their hands like this, I cannot move their hands. We cannot do anything to move them around. If they are facing your spine, that's also a harder picture. So, when is the best time to get a 3D and 4D picture? Is definitely going to be around 28 to 32 weeks. Those are whenever I find for myself that I get the best pictures. Every tech does things differently. Every office does things differently. Understanding that the sonographer at your office, whenever you go see your doctor, they just might not be able to do it. If you're wanting to ask your office, say, I was wondering after we got everything we needed today and if baby did good, if we could maybe try a 3D or a 4D picture if this office allows it. It's best to approach it that way and not automatically assume that you're going to get these images simply for the fact that you do not know what kind of time restraint or schedule this sonographer is on. So now I'm just going to show you some of the images. We had the profile that I showed you. You're going to see images like this. I do hope this helps, and I hope you have wonderful 3D, 4D pictures. Have a good day.